you Adele and the network of Pennsylvania staff and volunteers of the State Health Insurance Assistance Program for joining me today. My name is Carla. I am the Director of Education and Partnerships at NeedyMeds. Today, I'm going to explain what NeedyMeds is, the educational and healthcare cost savings resources we offer, how to navigate our website, and how this information will hopefully help you better serve the population you work with. Before we get started, I want to go over a few tips. If you experience technical difficulties, please reach out to GoToWebinar at 888-646-0014. Hit the number 1 and then the number 1 again to speak quickly with an actual person. If you have questions throughout the webinar, you can type them into that questions section of your GoToWebinar control panel. Just know I will reserve answering questions until the end. And if I don't get the chance to answer your question, I will follow up with you via email. Of course, I will provide my contact information and the contact information for NeedyMeds at the end. And the PowerPoint slide deck that I'm using can be found in the handout section of your control panel. So with that, let's get started with what is NeedyMeds. What you are looking at is our mission statement, our vision statement, and a statement about how we achieve that mission. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. We do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. This slide lists the most popular and effective cost savings databases that we will be covering during today's presentation. So let's talk about what these databases are and how to find them on our website. So bear with me while I transition out of the website and onto the NeedyMeds homepage so I can explain just that. Thanks, everybody, for your patience. I'm just waiting for the site to pull up. And in the meantime, actually, this is a good reminder that if you have any questions throughout the presentation, don't hesitate to send them in by typing them into that questions panel, again, in your GoToWebinar control panel, which you should keep up on your desktop. So here's the NeedyMeds website. And as you can see, it's really full of information. So I'm going to encourage you, when you have time, to browse the website a little bit further. Now, before we dive into the cost savings programs, I want to point out a few other resources that I think you may find particularly helpful. One of the things is on the bottom left-hand side, you'll see a link for Be MedWise. This is a website that we now host, which provides accurate and up-to-date information on promoting the safe use, storage, and disposable medicines. Just look at all the information that popped up under that Use Medicine Safely tab. Anyway, it's a great resource I thought you would be interested in. Returning to NeedyMeds also, another great website, if you scroll down, is the Safe Needle Disposal website. As I'm sure you know, there are limited options, unfortunately, for proper disposals of needles and sharps, which can lead to dangerous situations for the public. So we hope you partner with us in educating the public about safe disposal for all at-home users of sharps and needles. And as a healthcare professional or a SHINE staff member or volunteer, please do check out this Advocates tab. This is where you will find a lot of easy ways to stay up to date on healthcare cost savings programs and timely healthcare topics. And I'll point out a handful of the resources under this tab I think that you would be most interested in later on in the presentation. So with that, let's get started with how to save the most money on name brand medications, which is with our Prescription Assistance Programs database. And you will find that if you let your mouse hover over that Patient Savings tab. And this is where we're going to spend the rest of today's webinar, under this Patient Savings tab. And as you can see, when my mouse hovers over that, a whole bunch of different categories on how to save on your healthcare expenses does pop up. And on the top left-hand side is an entire section dedicated to prescription assistance programs. And if you're not familiar with those, let me tell you what they are. Prescription assistance programs are programs that are usually supported by pharmaceutical companies and offer most of the time free and some of the time deeply discounted prescription drugs, usually name brand, to those that qualify. Now, of course, not every drug will have a prescription assistance program. And when one is available, eligibility requirements and applications will vary from program to program. One common requirement is that the patient's healthcare provider usually needs to be involved by providing the prescription, signing the application, and sometimes submitting documentation. And as you can see, there are a number of ways you can search for a prescription assistance program. You can search by the less common company or program name, and by the most common, by the name of the brand name of the drug. So I'm going to click on that hyperlink, and then what happens, and I'm going to make that screen a bit larger, the first thing that happens is a bunch of icons pop up. And what these icons do is they let you know what type of information is available for that drug. Is there a cost savings program available, such as a prescription assistance program or a coupon? Is there more information available through support pages or drug videos? As you can see, if I scroll down, there's also that convenient A to Z index, and you will find that in our larger categories to make your search easy. So let's say we're looking for a name brand drug called Lipitor. Obviously, I'd click on the letter L, and then I'd scroll down the list of medications to see if Lipitor is available. If it's listed more than once, click on all of the hyperlinks because it'll vary. The one on the bottom lets you know that there are support pages, and that's an icon for a coupon. The one above it reminds you again that there are support pages, but here, this icon indicates that there is at least one prescription assistance program available. I'm going to go ahead and click on that icon. And as you can see, what happens right at the top, there's that blue bar that says Program 1 of 3. That means that there are currently 3 prescription assistance programs available for Lipitor. When there are more than one, the one that offers the most assistance will be listed at the top, and the ones that offer the lesser assistance will be listed at the bottom. I'm going to make the screen really small. Don't worry about seeing the text right now, just so you can see a snapshot of all of the information the prescription assistance program listing would provide on the NeedyMeds website. And I hope you'll agree it's all the information that you'd need at a quick glance. At the top, you will always find the name of the supporting organization as well as their contact information. That's really important because if you or the client that you're serving has any questions about the program, we recommend calling the program directly as opposed to NeedyMeds. Underneath that, you'll always find the application section, and oftentimes you will find a hyperlink to an active PDF, which can be completed online and printed out. We always have the eligibility requirements section, and that's really important because we want to be able for you or your client in a quick glance to know whether or not they're eligible. Now, as I had said in the beginning, although eligibility is almost always will vary from program to program, it is always almost based on 3 things: insurance status, income, and residency. So let's talk briefly about each of those categories. One thing I simply want to point out really quickly is a lot of people make the mistake that I did before I worked at NeedyMeds, thinking that if you have insurance, you will not be eligible for these types of programs. And as you probably know, in many cases that is true. But as you can see here, that's not always true. So always check out the prescription assistance program category on our website to see if your client is eligible. Just because they have drug coverage or insurance doesn't necessarily mean they will not be able to apply. Now, income is always considered in the eligibility requirements, and it's almost always based on a certain multiple of the federal poverty guidelines. And because that's so common, we put a handy federal poverty level income calculator right here. I want to show you how easy that is to use. All you would need to know is your client's annual salary. And as you can see, I use this example a lot, and you'll notice I only typed in the digits. Don't put in periods, commas, or dollar signs. And that's the same information that they would put on their tax return form at the end of the year. So let's say this individual is supporting a family of 3. And unless they live in Alaska or Hawaii, that's all the information you need. So this individual's yearly income is calculated at 222% of the federal poverty level. Now, when I return to the income guidelines, this individual clearly qualifies, which is great. But let's say that they didn't. Maybe this individual found themselves slightly above the eligibility requirements at 305 or 310%. Well, when that happens, don't despair. If the income is slightly over the income limit, we recommend applying anyway. Oftentimes, they will simply, if it's within the ballpark of the eligibility requirements guidelines, they will fund it anyway. But even if they deny you, then you can ask for what is called an economic hardship exception. And at that point, if that's not successful, you can always officially appeal. The other thing that I want to mention is if you are working with an undocumented population, again, don't assume that there would be citizenship requirements or documentation for residency required to be eligible. Oftentimes, the residency requirements are just that, residency requirements. They just want to know that the person is living or being treated by a physician in the United States. And of course, if you have any questions, you can reach out to the program directly. Now, since you are working often with Medicare beneficiaries, be mindful in the eligibility section that lets you know whether or not those that are recipients of Part D are eligible. That's going to be really important. Always pay attention to the application section. This will tell you details about the application process, including how the doctor needs to be involved and the time frame that the decision will be complete. That's really important because you don't want to put your client in a position of missing their medication. The medication section underneath that will let you know where the medications will be mailed, for example, and the details for reapplying. Always be sure to check out that additional information section because that is where we put all other pertinent information that does not fall neatly into the other categories. Now, application for prescription assistance programs can be complicated. Because of that, we've put together a directory that lists nonprofits that will help people apply to these programs. And the places we have listed are usually free or will assist you for a very nominal fee. And you can check that out if one's available in your area in Pennsylvania by clicking on that Help with Prescription Assistance Applications. So I do have a question coming in regarding what income is used in the eligibility requirements. You would put in the income that the person would list as if they were filling out their tax return information. But if you need more specifics, I would direct you to call the program directly. They usually have a toll-free number, as in this case. So let's move on from prescription assistance programs so I can talk to you about a way to help your clients save money on generic drugs, which is with our $4 generic discount drug program. And you can see again, we're under that patient savings tab on the top left-hand side. This is a directory of all the discount programs for generic medications available at major retailers. Now, although this is called the $4 generic discount drug program, most do range in price from $4 to up to $15 for a 30, 60, or 90-day supply. And as I scroll down, you can see that there are a number of ways to search. You can search for the name of the participating pharmacy or store. You can search for a particular drug, but you can also search just to see what stores in your state are participating. So let's see what's available in Pennsylvania. So the results yield that there are currently 10 discount drug programs or stores, participating in Pennsylvania. And again, I hope you'll agree that all of the pertinent information is on your screen. The left-hand column will have the name of the participating store and the hyperlink. And as you can see, all of the large national chains are included, such as Costco and Rite Aid and Walgreens, but there's also regional participants as well, and sometimes smaller pharmacies. Next, you'll find the program name, and the far right-hand column labeled program is what you really want to look at. It lets you know how much this program will help your client to save. Now, as I said, although it's called the $4 generic discount drug program, most will range in price from $4 to up to $15 for a 30, 60, or 90-day supply. Sometimes the savings is estimated with the percentage as opposed to an actual price. But this is certainly worth checking out. And again, if you have any questions, don't hesitate to type them into that question section of your GoToWebinar control panel. And I'm going to take a moment also to remind everybody that if your client doesn't have the luxury of having access to the internet or computer, please simply provide them with our 1-800 number. And again, that's 1-800-503-6897. The good thing is we are also on the East Coast. We're open Monday through Friday, 9 to 5 p.m., and we do have Spanish-speaking counselors. And again, for you guys, feel free to call our experts directly if you're having difficulty finding what you need, and be vocal about your experience on our website. We certainly consider users such as yourselves partners. So let's move on to other helpful sections of the NeedyMeds website, which is our free low-cost or sliding scale clinic database. Now, as you can see, something I'm proud to let you know, this database is actually broken up into 4 separate databases. We used to just have dental and medical clinics, but now we also have mental health clinics as well as substance addiction clinics to make this search easier. One thing I do want to point out is a lot of times people pass over this section because they feel that they're helping a client that has already been being treated at a convenient primary care physician's location, which is great. But people's circumstances change. So just because they're being treated at one location doesn't mean they're going to have access to that a year later or a month later. So being mindful of other clinics in their area that are convenient and affordable is really important. And also being aware of clinics is important because sometimes people go to the emergency room, not because it is necessarily a medical emergency, but maybe they just need to be treated and it's outside of regular doctor's hours. So being aware of the clinics in their area is a good thing to know about. So all of these databases are set up the same way. So for the purposes of this training, I'm just going to click on the medical clinics hyperlink. And as you can see, it's a pretty robust database. We have more than 16,000. We're closing in on almost 17,000 free, low-cost, or sliding scale clinics across our country. Now, because this database is so large, you can search really narrowly. For example, you can help one of your clients find a clinic close to their home by typing their street address, but I'm just going to do a broader zip code search. So let's type that one in, and I'm going to do within 5 miles of the 16501 zip code. And again, like I said, you can do that more narrowly. So the results yield that there are currently 11 free low-cost or sliding scale clinics within 5 miles of the 16501 zip code. So here's a snapshot of all the pertinent information about these clinics. We'll talk about that print column on the far left side in a moment. But next to that, you'll find the column for clinic, which has the name of the clinic, their contact information, and a hyperlink to their website if one is available. Next to that, you'll find the eligibility section, and that's really important because it'll let you know who can be treated at the clinic and what fees, for example, the client or patient can expect to incur. The right-hand column lets you know details about that clinic, such as what services do they provide and when are they open. Although we pride ourselves on the information on our website being accurate and up to date, we always recommend the patient calling the clinic or visiting their website for details such as hours of operation, who can be treated at the clinic, if the staff speaks other languages, and what fees would be involved. Now let's get back to that print column on the far left side. So this list that we pulled up has 11 clinics on it. Now, let's say you wanted to simply provide your client with a list of these clinics. Well, you click on Print All. But maybe you scroll through this list and click only the ones you think your client would be interested in. Then you would choose the print instead of the Print All, and it'll do just that. It will generate and print a list including only the ones you choose. And again, that's a great tool if you want to provide your client with a list that will be most useful to them. A great question coming in is whether or not we have clinics specifically dedicated for people 65 and over, or to those Medicare recipients. So we do not have a database dedicated to specifically that. What I would suggest is two quick things. Always checking the eligibility section, and as you can see, it will let you know whether they accept Medicare or Medicaid beneficiaries, and you could always check the services included section. Again, always reach out to the website or call the phone number at the clinic to get those specific answers. And certainly, please do let us know if we have information on our website that is not accurate or up to date. So just a reminder, because another question coming in, how I got to this free and low-cost clinics database is under this Patient Savings tab. Towards the left-hand side, you will see a section for free, low-cost, and sliding scale clinics. And when I pull that up, you can choose which clinic you're looking for: medical, dental, mental health, or substance addiction. And this time we did a broad search for medical clinics. Thanks so much for those questions. So returning once again to that Patient Savings tab, another great and popular database is on the bottom left side: coupons, rebates, and more. And this is where you can find prescriptions and over-the-counter medications or supplies for which there is a printable coupon, a rebate, a savings card, a free sample. Now, just like our other databases, you can search a number of ways. You can search by the brand name of the drug, by the product name, but in this case, you can also search by category, which means medical category. And then when I pull up this page, you can see a list of alphabetized medical categories. So let me show you what this looks like. Let's say you have a client that suffers from allergies. You click on that hyperlink, and the great thing is there are those icons again. So that means if you see a listing for a particular drug or product name, it will also let you know if other cost savings programs are available, such as a prescription assistance program, as well as whether there's more information available about that drug or product through the support pages or drug videos icon, for example. And then the products and drugs, as you can see, will be listed alphabetically. So let's talk about what you're looking at on your screen. We actually updated this database. We used to just have a paragraph of information, and that was really hard to read. So based on user feedback, we broke it down into much easier to read bullet points. We also include a link to the manufacturer's offer in case anybody has more questions. And we added a really convenient way to print out or have us email or text you the NeedyMeds drug discount card. And of course, I'll talk to you a little bit later on about how to use the NeedyMeds drug discount card to help your clients save on their medications. Now, returning to that patient savings tab, the second greatest source of savings after the prescription assistance programs is through the diagnosis-based assistance programs. And again, I'm letting my mouse hover over that patient savings tab, and this time I'm going to the middle to that hyperlink that says diagnosis-based assistance. Diagnosis-based assistance programs provide financial assistance for costs associated with a particular diagnosis. Now, this database is different because for the most part, it doesn't include medicine. What it does include instead are other necessary medical expenses. For example, maybe somebody needs help affording medical supplies, medical equipment, or maybe they need testing supplies, or maybe they need help affording something like a wig or house cleaning services or assistive technology. You can find assistance for any of those medical expenses in the Diagnosis-Based Assistance Programs database. And you can search a number of ways. You can search by the diagnosis. You can search geographically by state or nationwide. Or you can search by the less common program name. You can also search really specifically by the diagnosis as well as the state and what services are provided. Let's do a broad search for diagnosis. Now again, because this database is large, you will see that convenient A to Z index, and I'm going to go ahead and click on D for diabetes. I like to use diabetes as an example because not only is it so common in our country, but it's a great example of a diagnosis that requires a lot of expense oftentimes in addition to medication. Now, because diabetes is such a broad category, it's broken down into a bunch of subcategories, but just for this training, I'm going to click on the general hyperlink for diabetes. And when that pops up, you will see the results indicate that there are currently 69 diagnosis-based assistance programs for diabetes. And you probably noticed every time we get the results of a search, I always say currently has, and then I say the number. And the reason is our website is always changing. We pride ourselves on the information being accurate and up to date. We have teams of researchers dedicated to just doing that. So if there is a diagnosis, a product, or a medication that your client needs help with and what is not currently on the NeedyMeds website, check back because we're regularly updating it. Okay, so getting back to these search results for diagnosis-based assistance programs, again, there's 69 of them. And like the other databases, now you'll see a snapshot of what these programs are. On the left-hand side, you'll see the program name and a hyperlink to the program if available. Next, the summary of the program, and most importantly are those far right columns, the services that the program provides and the areas of service. Now, the services that this program provides is exactly that. What does this program offer? Now, oftentimes it will offer things like medical supplies or assistive technology, but as you can see, it varies. This one offers help with respite care. This one offers help to get access to a service animal. And you probably also noticed that on the right-hand side, it says national over and over. National means regardless of where your client resides in our country, they are eligible to apply. So the national programs are listed first, and then the rest of the programs are listed by state alphabetically. And I'm just scrolling down to see if anything is available specifically in Pennsylvania. And it looks like that there is one program available in your state. But again, your clients would be eligible to all of the dozen or so national programs listed at the top. And because we're talking about diabetes, I want to remind you of that safe needle disposal website on the left-hand side, because a lot of diabetics do require needles or syringes. And I'd love for you to check out that safe needle disposal site as well and give us your feedback. We totally revamped it last year, and we'd love to know your opinion. So since we're on the topic of finding diagnosis-based assistance programs, I want to point out again under that patient savings tab, diagnosis information pages. These are informational pages or educational pages dedicated to specific diagnoses. And as you can see, they're alphabetized to make the search easier. With these pages, our goal is to partner with reputable nonprofit organizations to provide the most comprehensive information about a particular diagnosis. I don't want to spend too much time here. I just wanted to make sure you knew about this destination, especially if you have a patient that is newly diagnosed. Returning to that patient savings tab, we also have a database dedicated to medical transportation. Again, I'm not going to spend too much time here because hopefully you're starting to see that the databases are all set up similarly. That's purposeful. We hope that once you familiarize yourself with one section of our website, you'll be able to make your way through the other categories. Now, medical transportation we included because oftentimes getting to and from a doctor or specialized facility can present an obstacle. So last year we added an entire database for medical transportation. We also have databases dedicated to retreats, camps, recreational programs, and educational scholarships. And these are pretty self-explanatory. One thing, though, I do want to mention is don't pass over, for example, the retreats, camps, and recreational programs. When I think of camps, I think of kids and summer times, but this is purposefully named retreats, camps, and recreational programs because there are programs available to people at all ages in all parts of the country at all times of year. So I doubt you have a client coming to you wanting help to find a retreat for them. But the point is, you may find something that will really benefit your client or their family that they didn't even know existed. I want to spend just a moment talking about our government program section. This is a great resource if you are working with Medicare beneficiaries. Of course, you can find all regular state-sponsored programs, but as you can see, you can find pretty exhaustive information about Medicaid and Medicare. And of course, your programs are listed here as they are crucial in helping Medicare recipients. And we are proud of our partnership with Ship and Shine programs throughout our country. And as you know better than anyone, when we're dealing with state programs, oftentimes it's based on income. So for that reason, we put a convenient guide to our federal poverty guidelines, as well as a quick way to request a tax return form. So bear with me while I escape out of our website and return to our PowerPoint presentation so I can talk to you about how to use the NeedyMeds discount card to help your clients save on their medications. Now, the NeedyMeds, let me just get right back to that appropriate slide. Bear with me. So we're talking about the drug discount cards. And again, this is another important way you can help your clients to save on their medications. Now, I'm sure you've heard of drug discount cards because there's a lot out there, and you probably know what they are. Drug discount cards is just that. It's a card that you take together with your prescription to a pharmacy and see if there are savings available. And as I said, there's a lot of drug discount cards out there. Well, the NeedyMeds drug discount cards differ because they are free, they're anonymous, there is no registration, no enrollment, no residency, and there is no activation required. Users can save between 0 and up to 80% off of the cash price of prescriptions. The reason I say between 0 and up to 80% is because it's important to know that not every product or drug will be discounted. And you can even use the NeedyMeds drug discount card to save on your pet prescriptions if you pick them up at a People pharmacy. A couple other things I want to mention about the drug discount card. It only works for brick and mortar pharmacies. It is not accepted online. And the card offers a savings 85% of the time it is presented to the pharmacist. And usually that savings an average savings is 50% off of the cash price. So who can use the card? The simple answer is anyone. The only rule is that it cannot be combined with insurance. So if you're working with somebody that does not have insurance, they can use the card anytime. If your client does have insurance, they actually may want to use it instead. And they may want to do that because they find that their medication is not covered under their insurance. Maybe they find themselves in a coverage gap. Maybe they have a really high copayment or high deductible. One thing I do want to mention, considering the population you work with, that the money used to purchase a medication or product with the drug discount card will not help the patient to get out of the donut hole. So if your client is getting prescriptions filled and it's the beginning of the year and they have a chance of getting out of that donut hole, I would say don't suggest they use the drug discount card. But if it's November or December and they're not going to get out of that donut hole, they may choose to use the drug discount card to save on some money. So let's return to the website once again. Hopefully I'm not making you dizzy with the switching back and forth, because I want to point out where you can request your NeedyMeds drug discount card. So as you probably guessed, there's a number of destinations on our website that will take you to our drug discount card page. Under that patient savings tab, you'll find a couple of links, one on the top left-hand side, one on the bottom right-hand side. Sorry, that popped away right there. But also on the home page, you will see a box with a red arrow that says Get Your NeedyMeds Drug Discount Card. And they will all take you to this page where you can have your client request a drug discount card. It goes without saying that we would be more than happy to send you a bulk supply of drug discount cards to have on hand. But you can always have your client give us a call directly. We can drop one or a bunch in the mail for them. They can print out a downloadable PDF. They can fill out this form requesting a design. Probably the least easy way, but still an option, is to send us a self-addressed stamped envelope to our P.O. box. So hopefully that you'll find obtaining a NeedyMeds drug discount card for your clients super simple. So now let's say your client has the NeedyMeds drug discount card. The next thing they want to do is find out what pharmacies in their area accept the NeedyMeds drug discount card. So that's really easy. At the bottom of this page, you will see something called the pharmacy search. That's what you're looking at right now. And in that pharmacy search, all you have to do is type in a zip code. So let's see what's available in the 16501 zip code, and we'll do within 5 miles of that. So the results yield that there are currently 39 pharmacies accepting the NeedyMeds drug discount card within 5 miles of the 16501 zip code. And hopefully you'll agree that there's all the pertinent information about that pharmacy, including the name, the location, their phone number, and even a map to help the person figure out where it's located. And you can also print this out if you want to provide your client with a list of participating pharmacies. So now let's say your client has the drug discount card. They know what pharmacies are participating in their area. The final step is, how much is this medication going to cost me using the drug discount card? To figure that out, you check on the drug pricing calculator, and to get the estimate, you will need 4 pieces of information: the name of the drug, the day supply, is it 30, 60, or 90 days, for example, the dosage, and the zip code where the person plans on picking up the medication. A couple of things I want to stress is that the drug pricing tool prices do vary. They're constantly being negotiated. So don't find out what the drug price is today and go pick it up a month later. You're going to want to find out what the price is before your client heads out the door. The other thing I want to stress is that it provides an estimate. So although it will be a close estimate, it will not be accurate down to the last penny. And I am always sure to say that in my presentations because I gave my mom the drug discount card, and it was, I forget if it was 4 or 5 cents off when she went to pick it up at the pharmacy. So I make sure to always say that it is an estimate, and although it's close, it will not be accurate down to that penny. So I'm going to transfer once again out of the live site back to the PowerPoint presentation so I can talk to you. In the beginning, I did mention to you that under that Advocates tab on the navigation bar on the top of our website, there were some additional resources I thought you would be interested in since we spent most of today's presentation under that Patient Savings tab. At the top, you'll see I wrote Drug Discount Card Partnership. What that means is if you are interested, and Adele, I'll probably follow up with you with this via email, we can create a drug discount card with your location's name and logo. So there can be a drug discount card for APPRISE or the Pennsylvania State Health Insurance Assistance Program. It'll have that name and logo on it instead of the NeedyMeds name and logo. That is free of charge, and we will send you an unlimited supply of plastic cards as well as a PDF. And what that does, it allows you to distribute cards with the prize's name and logo on it, but it will also allow us to provide you with a free complimentary monthly report, which will let you know how many times your drug disc card is being used and the dollar amounts of savings. And for those of you interested in learning more about this, let me know. And if you are interested in ordering a supply of bulk generic NeedyMeds drug discount cards and or educational brochures, send me a message in that question section of your GoToWebinar control panel, and I would be happy to be back in touch with you. Under that additional resources section, you will also find our calendar of upcoming webinars. So we do hope you find ones that you'll be interested in. We do about a webinar a week, and you can also register for webinars on the bottom right-hand side calendar of events. If you are interested in changes we make to our prescription assistance programs or diagnosis-based assistance programs, our two large databases, we can send you email alerts every day or once a week, letting you know about those program changes. In January, we worked really hard to kick off our updated monthly newsletter. It used to be called Patient Assistance Newsletter. We rebranded it Vitals, so we'd love for you to sign up for that. It's a great way to stay up to date on what's going on with NeedyMeds and healthcare topics in general. And again, we're happy to send bulk supplies of brochures and educational materials because they're not helpful just sitting on the NeedyMeds shelves. So with that, I'm going to remind everybody again, I do see a couple of questions coming in. And if you do have questions, go ahead and type them into that question section of your GoToWebinar control panel. And as I answer some of those questions coming in, I'm going to go ahead and leave up our contact information as promised. So a couple of questions coming in is, how does NeedyMeds support itself? And we get that a lot. Thank you for asking. We are a nonprofit, and you can find information about that, how we support ourselves under the About Us tab at the top of our website. Under About Us, you'll find a link to our mission statement, and it'll let you know how we support ourselves. And you can find our most recent financial statement. But simply put, we rely on basically 6 sources of financial support. We license fees for organizations' uses of our database. We do sell a software called APPRISE that helps clinics simplify the patient assistance program application process. We do get a nominal fee on every use of the free NeedyMeds drug discount card. We have thoroughly reviewed supporting partners on our website. We charge fees from pharmaceutical companies for call center and application processing services. And like every other nonprofit, we rely on corporate and individual donations as well as grants. Oh, here's a great question. In the beginning, I mentioned that you can use the drug discount card to save on pet meds. How? Actually, we did put together a less than 10-minute video on how to use the NeedyMeds drug discount card to save on your pet meds. You can go to the NeedyMeds YouTube channel, which is on the top right-hand side of our homepage, and then you could type the word pets into the search bar. Or you can just shoot me a message now, and I would be happy to send you the link. And the most important thing with that is you will get to see a picture of my dog Benjamin, who is super cute. Here's another question coming in. Can people with Medicare Part D apply to prescription assistance programs? So I hate to give this answer, but the answer is it depends. In that snapshot of eligibility requirements, there is a line dedicated to specifically whether or not those with Medicare Part D will be eligible. So the great thing is you can just take a quick look at that and it will tell you right away. But the answer is it does depend, and it does vary from program to program. So it looks like those are all of the questions coming in, and I did get requests from those of you interested to receive some NeedyMeds drug discount cards and brochures, and I will get in touch with you tomorrow morning to iron out the details of that. With that, I want to thank you all for taking time out of no doubt what is a really busy afternoon to learn a little bit more about NeedyMeds. We do hope you consider us a partner in helping the population you serve. And as I said, we are proud of our partnership with you, and we know that the work you do is invaluable. The community is lucky to have you. Thanks so much for your time. Stay in touch with NeedyMeds and have a great rest of the day. Take care.